Hi, I'm Dr. Sharma from Provident Dentistry.
Hi, I'm Renee. I'm a hygienist at Provident Dentistry at Canton Park.
In this video today, we'll be discussing of some different lesions that are found in the mouth. Some of them are harmless and common, and the others are rare and worrisome.
Yeah, so let's start with probably the most common lesion, the aphthous ulcer, or more commonly referred to as the canker sore. I think everybody has probably had a canker sore at one point in their life. It starts as just a small, painful bump, and it usually takes about 2 weeks to go away. So if you notice anything in your mouth that you think might be a canker sore, do make sure that it goes away in 2 weeks. If not, give your dentist a call to evaluate it. We want to make sure it's not something more worrisome.
Okay. Another common lesion that's seen in the mouth is called as linea alba. When you move your cheek aside, you'll suddenly see these white lines. That's another common lesion that we can see in the mouth. That's commonly found on the cheek area and sometimes on the tongue as well, the side of the tongue.
Yeah.
These are commonly seen in people, those who grind their teeth, or there's pressure of irritation, sucking. A lot of times you have a sucking effect when you sleep at night. In those cases, what we usually tell the patients are that come see a dentist, make sure that's what it is, and then we can make them a night guard so it prevents them from grinding and causing that lesion.
Yep. Another common lesion in the mouth is the Herpes Simplex virus, or more commonly referred to as a cold sore. These can last for years or be lifelong, and they are highly contagious in their active phase. If you have a cold sore and it's active, red, has some fluid, you want to make sure that you don't have any mouth-to-mouth contact with anyone, share utensils, cups. Mothers can pass this virus to their children with kisses, so just be very careful not to come in contact with anyone when you have that. If you do suffer from cold sores and you notice one coming on, if you give our office a call, we have a special laser that can help greatly reduce the discomfort and the time that the cold sore will last, and sometimes it will catch it before it even starts. And we've had people say that once their cold sores were lasered, they never got them again.
Absolutely.
Yeah.
Another common lesion is the Hpv virus. It's contagious. It can spread from mouth to mouth or mother to children, as you said for the other lesion too,
Right.
but this one as well. It can show anywhere in the mouth, but the common areas that you'll see, it's usually on the tongue, the soft palate, the roof of the mouth, and the lips. HPV, they come in different shapes and sizes, and sometimes they resemble a common wart. So keep a watch on that as well. Most of the HPV, they clear within a year, but make sure you follow up with your dentist or the doctor as well and get it checked, because they can turn to an oral or esophageal cancer. So very important that you see any of these lesions, always get them checked.
Oral cancer is probably the scariest topic on this list. If caught early, the survival rates are greatly improved. Oral cancer can take many forms. It can look like a flat white patch, it can look like a red ulcer, it can look like a bump in your mouth, and it can occur anywhere in your mouth. But usually the most common spots are the back sides of the tongue. So that's why when you go to the dentist, you always notice us pulling your tongue out. Tobacco, alcohol, and HPV are the most common risk factors for oral cancer. So this is especially why it's important to see your dentist twice a year. We have a special light in our offices called the Velscope that can detect a lesion in your mouth so early that before it's even visible to the naked eye.
Yeah. So if you notice any suspicious sores or bumps in the mouth, just keep a watch on it. Make sure it goes away in 2 weeks. If it persists and carries on, it doesn't go, make sure you come to us and get it checked, because we just want to make sure it's nothing to worry about. But just to be on the safe side, do come and visit us.
Thank you.